That's good to know. Hello everyone. Before I start my speech, I'm not sure if I understood Stella correctly, but if a Be Kind to WPath memo went around before my speech, I didn't get it. Of course, it's an honor for me to be here in this room today with so many brilliant and courageous people. And of course, as you can see from the title of my speech, I'm going to be talking about the diagnosis of gender dysphoria, not only how it's an incomplete diagnosis, but it's also the most dangerous and harmful diagnosis in psychiatry today. But before I go there, we are all here in this beautiful city of Lisbon because the World Professional Association for Transgender Health is just moments down the road. So I thought it was only fitting to take a few minutes of my time to recap just how spectacularly awful 2024 is shaping up to be for WPath. The first blow came in March when Michael Schellenberger and I released the WPath files, which revealed to the world what most of us, all of us, already knew in the gender debate, that WPath is a fringe group of activists masquerading as a professional medical association, advocating for a reckless experiment to be performed on children, adolescents, and vulnerable adults. WPath responded to these accusations by saying, "The world is not flat. Gender, like genitalia, is represented by diversity." So at least we know they're not flat earthers. Then in April came the Cass report, which was the result of a 4-year-long investigation into England's Youth Gender Service. And part of that report was a systematic review of the guidelines in gender medicine that revealed WPath, along with the Endocrine Society, manufactured a consensus on gender-affirming care. They produced shoddy guidelines based on the flimsiest of evidence that triggered a cascade of equally shoddy guidelines and policy statements from medical associations all over the world. So what you're looking at on the screen, this is a tangled web of circular citations, and at the center lies an empty shell, devoid of anything resembling real science. And then finally in June came the unsealed documents in a legal challenge to Alabama's ban on youth gender medicine that could not have been more damning for WPath. Emails released as part of the discovery process revealed, among other things, that top WPath members had interfered with supposedly independent systematic reviews, suppressing evidence that didn't suit their political goals. That Admiral Rachel Levine, a member of WPath and Biden's Assistant Secretary for Health and Human Services, pressured WPath to remove the minimum age requirements in its Standards of Care 8 because citing concerns that these recommendations would undermine the Biden administration's political agenda. And lastly, that some Standards of Care 8 authors, along with social justice lawyers, shunned evidence reviews because they knew the results would reveal little to no evidence, and this would in turn harm litigation efforts. But my favorite is the next one, not because it's damning, but just because it's really quite hilarious. When the American Medical Association refused to endorse WPath Standards of Care 8, then President Walter Baumann was so enraged that he called the AMA members white, cisgender, heterosexual hillbillies from nowhere. So I think it's safe to say that WPATH's carefully crafted facade as a respectable professional medical association has been well and truly demolished. And the world now sees them for what they are. They're trans activists armed with syringes and scalpels who prioritize politics over the health and well-being of some of the most vulnerable people in society. And it's only going to get worse for them from here on in. Okay, but enough about that, because I want to get to the most destructive diagnosis in psychiatry today. Successful, effective medical treatment begins with an accurate and timely diagnosis. Without a clear picture of what is afflicting a patient, doctors cannot provide appropriate treatment, which is why misdiagnosis is one of the leading claims in medical negligence. So just imagine the catastrophic damage that would occur if an entire field of medicine were based on an incomplete, dangerous, and practically meaningless diagnosis. Of course, you don't need to use your imagination to picture the chaos that would ensue, because you just need to look around at the world. That's exactly what's happening. And it's the reason we're all here in this room today. In the American Psychiatric Association's great work of fiction, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, the diagnosis is gender dysphoria. In the World Health Organization's International Classification for Diseases, it's gender incongruence. These diagnoses manage to be exceptionally dangerous, yet almost completely devoid of meaning, both at the same time. I happen to have spent the last few months immersed in the DSM, and I have to say I don't recommend doing that. Because what happens when you spend too much time reading the DSM is you start to diagnose yourself and everyone around you with mental disorders. There's actually a term for this. It's called psychology student syndrome, inspired by the well-known medical student syndrome. So when medical students are studying all the various diseases, they start to believe they're experiencing the symptoms themselves, and psychology students do the same thing with mental health conditions. So in the last few months, I've put one of my children on the autism spectrum, I've diagnosed another with body dysmorphic disorder, and another with ADHD. And while I was reading the diagnostic criteria for ADHD, with things like forgets to return calls, is easily distracted, often loses keys, I thought, oh my God, I have ADHD. That's why I can never find my keys. In truth, we have none of those disorders. We're simply human beings with our quirks, insecurities, odd habits, and occasional disorganization. But it's all too easy to apply DSM diagnoses to your life, to interpret your oddities, your strange behaviors, or your pain through the lens of a particular diagnosis. A diagnosis can also be very powerful, shaping the way you see yourself and the way you behave, and people can become deeply attached to a diagnosis, particularly if it provides a sense of relief or comes with the promise of a cure. And as I've already said, today there is no more dangerous diagnosis to apply to your life than gender dysphoria, or even worse, to apply to your child's life. Before I get to the absurdity of the adolescent and adult diagnostic criteria, let me say a few words about the diagnosis of childhood onset gender dysphoria. Gender nonconformity in childhood only became a psychiatric disorder because in the 1950s, men seeking the impossibility of a sex change began showing up in clinics recounting stories of childhood femininity, prompting researchers to study feminine boys. Many of the stories these men told were likely fabricated just as a way to get the hormones and surgeries that they so desperately desired. But by the time psychiatrists realized that, it was too late. Gender nonconformity in children had been pathologized, and psychiatry had opened the door to one of the most harmful concepts of all time, the transgender child. It cannot be said often enough or strongly enough that there is no such thing as a transgender child. If a little boy says he's a girl, the adults in his life need to tell him, kindly but firmly, that he is not, and he never can be. It is our duty as adults to keep children tethered to reality as they explore the world and find their place within it. Help gender nonconforming children build resilience. Don't label them with a psychiatric disorder. So moving on to the adolescent and adult diagnosis, diagnostic criteria in the DSM-5. Now, as something of a connoisseur of the DSM, I can honestly tell you that every time I look at these 6 diagnostic criteria, I find myself flabbergasted. It's just pure ideological gibberish. We've got 1 marked incongruence between your experienced and expressed gender and your body, which is basically nothing more than stereotypes. 4 strong desires: to be rid of one's sex characteristics, to have the sex characteristics of another gender, to be of the other gender, to be treated as the other gender. Absolute nonsense. And I love how they tack on, or some alternative gender, different from one's designated gender. How very scientific. And then the last one, a strong conviction that one has the feelings and reactions typical of the other gender, which is obviously something no one could never, ever possibly understand. This mind-boggling list of subjective feelings is the result of decades of pressure by trans activists, such as those congregated in a hall like this not far away, who one day decided that believing yourself to be a member of the opposite sex and wanting healthy body parts chopped off was not a mental illness, not because of any new scientific discoveries or the results of rigorous research, but simply because they didn't like the label and it didn't suit their political goals. So instead of gender identity disorder, which it was in the DSM-4, that pathologized the cross-sex identity, so activists demanded the APA change it to gender dysphoria, and that shifted the focus of to the emotional distress caused by having a mismatched gender essence trapped in the wrong sexed body. This is pseudoscience, plain and simple. So because trans activists have stripped the diagnosis of all meaning, it's tempting to dismiss it as not being real. But it is real to the person who experiences it, despite not being real in, say, the way cancer or diabetes is real. The pain is real, and because gender dysphoria exists in the symptom pool of our time, meaning it's a legitimate way to interpret and express your pain and be taken seriously by doctors, it's necessary to proceed as if it's real. So I love Ian Hacking, so taking a leaf out of philosopher Ian Hacking's book, the important question is not to ask, is the diagnosis real, but is it beneficial? Does it help a sizable number of people who satisfy these criteria to treat them as if they have gender dysphoria? Currently, such treatment spans 3 distinct branches of medicine: psychiatry, endocrinology, and surgery. When someone walks in off the street declaring themselves to be transgender, to know themselves to be a member of the opposite sex, to know themselves to have the feelings and reactions of the opposite sex? Is it always good, or perhaps always bad, to usher such an individual onto the medical transition conveyor belt? Will this make their lives better or worse in the long run? These are the important questions. Which brings me to the main point I wish to make today. No one benefits from receiving this diagnosis. And the reason no one benefits is precisely because it is an incomplete diagnosis and therefore cannot be helpful. And most importantly, absolutely no one should be embarking upon a drastic, irreversible medical pathway based on this diagnosis. A diagnosis of gender dysphoria is the beginning of the diagnostic process, not the end. The only way to help those who satisfy these diagnostic criteria is to ask the all-important question, what's behind the symptom? What's behind the strong desire to be rid of one's sex characteristics? What drives the strong desire to be of the other sex? What causes a person to wish for the secondary sex characteristics of the opposite sex? Now, in the trans-activist world of WPATH and all the rest of them, in gender-affirming medicine, there is no need to ask those questions because the answer to all is that the person is transgender. And you can see that they even had this written into the diagnostic criteria. Look at criterion B. The reason people have a strong desire to be rid of their sex characteristics is because of a marked incongruence with their experienced and expressed gender. That's just a fancy way of saying the person is transgender. And because in WPATH's world, being transgender is a natural, healthy variation of human existence, there is no need to investigate further. In fact, it's transphobic to do so. Which brings me now to probably the most controversial thing I'm going to say today. And that is, in the medical world, there ought to be no such thing as a transgender person. Now, I can already hear the screeches of trans activists accusing me of denying the existence of transgender people. I am not. Well, not really. I accept that transgender is a political identity, but that identity has no place in medicine. Doctors need to be able to see their patients in order to treat them effectively, and the political label of transgender acts as a smokescreen, blurring their vision. So what do we see when we lift the rainbow veil and really look at the people who meet the diagnostic criteria for gender dysphoria? We see men with autogynephilia who are aroused at the fantasy of becoming women, who have a strong desire for the secondary sex characteristics of the opposite sex to embody the object of their own desire. We see a tiny number of extremely gender nonconforming homosexuals, many with internalized homophobia who have a strong desire to be treated as the opposite sex as a way to be invisible. And we see legions of young, confused people making sense of their pain and distress through the fashionable lens of gender. They are lost, they are lonely, and they are hurting, and they are desperately searching for a solution. These young people have astronomically high rates of autism and plenty of ADHD. Some display traits of borderline personality disorder with its classic characteristic of an unstable sense of self. Others are just discovering a homosexual orientation and they haven't quite accepted that yet. And then there's depression, anxiety, and so much trauma. These are unhappy people in search of happiness who are seduced by the impossible promises transgender ideology makes. Adopt a new name, new pronouns, take hormones and undergo surgeries, and you can be a whole new person. Receiving a diagnosis of gender dysphoria from an expert confirms their self-declared transgender identity. It gives it legitimacy. They don't understand that the diagnosis was written by trans activists who prioritize politics over patient health. They don't understand that the experts handing out the diagnosis are true believers in an ideology that has no grounding in reality. In a medical setting, everyone who satisfies the diagnostic criteria of gender dysphoria must be treated as an individual, someone with a complex past that has shaped their understanding of themselves as a transgender person. But none are transgender in a medical sense, because there's no such thing. All deserve an accurate, complete diagnosis to understand themselves and why they have come to the conclusion that drastic, life-destroying medical interventions are the solution. Dr. Alan Francis, who was chair of the DSM-4 task force, which happens to be my favorite DSM, he says psychiatric diagnoses should always be written in pencil, especially for teenagers, because it's very easy to make the wrong decision, the wrong diagnosis, and very difficult to correct that mistake. But I believe there's another reason to write the diagnosis in pencil, and that is because many expressions of human suffering that we now view as symptoms of mental disorders are transient. They're just a natural response to life's struggles. Psychiatric diagnoses should therefore be written in pencil because life is messy and sometimes it's difficult, especially in adolescence. But it typically gets better, and when it does, those mental health symptoms may disappear or recede into the background. But gender-affirming clinicians don't believe in writing the diagnosis in pencil. They advocate for it to be written in blood, for it to be carved into the bodies of young people whose brains haven't even finished maturing yet, without even attempting to help them work through their distress, not even giving them the chance to grow and mature, persevere, and overcome their struggles. So, I may just be a white, cisgender, heterosexual hillbilly from nowhere, but I know a medical scandal when I see one. It is a crime to sterilize young people who still have their whole lives ahead of them. For surgeons to amputate the healthy breasts of teenage girls or castrate young gay men who haven't even had a chance to accept their sexuality yet. But to do so on the basis of an empty diagnosis and because the young person has adopted a fashionable political identity is an act of evil that is beyond comprehension. Successful medical treatment begins with an accurate diagnosis. In the case of gender-affirming medicine, medical mistreatment begins with an incomplete, meaningless diagnosis. Psychiatry can and must do better. Thank you. Oh, okay, so we're doing a Q&A. If anyone has a question for me, raise your hand.
Hi, I'm Kathy. I'm from Hoboken, New Jersey, and my daughter's 17. Has been in it for almost 4 years. My question is about the assessments. I'm deeply knowledgeable, hence being here, but she was assessed by the pediatrician in about 3 minutes, who then sent us, and we spent $5,000 on a neuropsych evaluation, which was mostly about ADHD. But he also diagnosed her with gender dysphoria. And then we went to a pediatric psychiatrist who, after 1 hour or 1.5 hours, also said, gender dysphoria. So they suggested that we go to a transparent support group who said we should let our child drive the bus, and we should just make an appointment at the pediatric endocrinologist, which we did within the first 6 months. And she said that we had, gender dysphoria as well, and that we should, she brought out a puberty blocker within the first 15 minutes, which really destroyed our family, because at that point I was like, this is not really what, I don't know, I just felt like, the whole idea of assessment. I'm just curious about your feelings on that.
I think my feelings are rather similar to yours. Really, there's pretty much no assessment, and that's why I went into the fact that the concept of a transgender person doesn't belong in medicine, because if you walk in and whoever's doing the assessment sees a transgender person before them, then they just tick all of the boxes, and that's the problem with that's why the diagnosis is completely pointless and meaningless. It's written by trans activists, of course.
Yeah.
And that you see in psychiatry, there's a lack of diagnostic reliability typically. If one patient can go to 5 different mental health professionals and get 5 different diagnoses.
We're looking for help.
But you see, if I don't believe that, I think one patient with gender dysphoria could go to 100 gender-affirming clinicians and get gender dysphoria as the diagnosis. There's no difference in they just see a transgender person and then they diagnose gender dysphoria, which is why I think gender dysphoria should not be a principal diagnosis at all.
That's exactly right.
Right.
That's what I think too. All right, thank you.
Thank you.
Frank Reddy, I loved your talk. You have a very incredibly good way of communicating.
Thank you.
There was one small point I kind of disagreed with, is when you talked about who becomes the recruiting body for this diagnosis. You talked about, for example, people with autism and ADHD. And isn't it there's a danger that just as there is a proliferation of diagnosis of gender dysphoria, so anybody who's slightly different than the so-called norm will get a diagnosis of autism. I mean, the most interesting children I know are all autistic. And, in my days, they would have been called interesting children. And, aside from that, we're shoving down Ritalin in children's throats, and we got all these diagnoses that we've invented as a way of making sense of the existential problems of childhood. So I'm just wondering why you said that, because I think that just as we've got to demystify gender dysphoria, so we have to demystify all these other categories that we attach to children's problems of life.
So I agree completely. The time for my talk was limited because I think you would have liked an earlier draft of this speech. And this gives me a chance to go into what I had, because it was really lovely. So I had this analogy in there that I read in a book by James Davies. It's called Cracked, I think, The Unhappy Truth About Psychiatry or something like that. And he talks about how mental illnesses are like star constellations, in that we just as people throughout cultures, throughout time, have joined together certain stars, made a picture and given it a name, so too have cultures joined together certain symptoms of human suffering, lumped them all together and given them borderline personality disorder or ADHD. So no, every diagnosis, that's why I call the DSM the great work of fiction, because that's what it is. All of the diagnoses in the DSM need to be scrutinized as much as gender dysphoria. And diagnosing a child with ADHD and robbing their childhood by giving them Ritalin is horrendous. But I chose gender dysphoria because it's another level of medical abuse that's occurring when somebody gets this diagnosis. But you're absolutely right. They all deserve to be scrutinized.
Hello? Mia? Hi.
Oh, hi.
Athena Davis here. So strategically, I totally agree with you. We should never use the term transgender child. But trans kids is such a sexy message. It's short, it's punchy, it's used everywhere. And protect trans kids is wonderful in a publicity stunt type of way. So whenever I write a text, and I write text in French too, so I don't know what is the proper term I should use. So could we please hear your thoughts on, like, you know, it's all clunky. It's like questioning youth, anguished children. You know, nothing sounds good. So I think we have to come up with some kind of language that we all use and say, this is it, and then we just use the same term and translate it in French and German and whatever, and, you know, what can we do to be as successful and not use that term?
Oh, okay. I mean, I think I'm going to disappoint you here in that I've labored over this for so long, because gender non-conforming children, that doesn't really cut it. Gender questioning, not even. I don't even like to use gender. They're just children. They're just children being children. And so I'm afraid I'm still working on that. And if there's anyone in the audience who has a better suggestion, shout it out now. There you go.
Hi, Mia. Thanks. It's Laurie Regenstreif. I'm in Canada. I'm a physician. We know each other. And I'm really pleased with your thesis about this, not even an incomplete diagnosis, but a completely inappropriate one. And just in response to the questions about assessment, because what I'm seeing from behind the curtain, which I see a lot of, and I have an involved child as well, what I see is what's really going on. So this specialist and this specialist and this specialist, the pediatric endocrinologist, the pediatric gender specialist, and so on, they're all building careers on this. And this is where it gets very sick in my perspective. And really where the assessment should be happening is in the adults around the child who need to be assessed, not the children themselves. The children don't need assessments.
Okay. Oh, hi.
Hi.
So I think that your framework that you provide of the incomplete diagnosis is absolutely genius. And I think that not only is the gender dysphoria diagnosis an incomplete diagnosis, I would even wager to suggest that it's incompletable. I think it's incompletable because the entire field of gender medicine is like attempting to experiment its way into understanding the human soul based on unproven and unprovable assumptions, like the ones of gender identity, for example. Nobody's proved that exists, yet we're medicalizing it. And I think it's really interesting when you bring up the element of experimentation that this entire field uses, because unlike other fields of medicine, it seems as if gender medicine isn't trying to settle its science. It's actually becoming, in the last century that it's been practiced, more and more experimental. You doing these interventions at younger ages, doing like the phallus-preserving vaginoplasties and all this other nonsense. And so my question to you is, I mean, how do you even put reins on an organization that will try to endlessly experiment its way into attempting to understand the human soul? Like, is it just lawsuits? Is it like what you did with the WPATH files and like public humiliation? Like, what can actually rein in an industry like this?
Certainly, lawsuits are going to be a big part of it, like they have been. If you look at multiple personality disorder, the last time psychiatry went mad, lawsuits brought that down, and lawsuits will bring this one down. But shining a spotlight on WPATH is always a good thing, because they only got to be where they are by lying and deceiving people. So as long as we keep shining that spotlight on them and decent, normal people see what they really are and what they really stand for, I don't know that we'll ever I'm not advocating for a total ban on all of gender medicine immediately, but I would one day very much like this medical experiment to be consigned to the dustbin of history with lobotomies, because it's not medicine and it's doing terrible harm.
Right here. Hi, would you like to introduce yourself?
Yes. Hello, my name's Louise Irvin, and I'm co-chair of Clinical Advisory Network on Sex and Gender. This is just a very quick question. In Europe now, we've got the ICD-11 diagnostic manual, and they have so-called depathologized it and called it gender incongruence. And my impression is it's just as vacuous. I just wanted to know the reason I think it matters is that sometimes when you start criticizing gender dysphoria and DSM-5, they say, no, we've got this now. They switch over to that. So I think we have to also be able to say that is just as much rubbish, but I just wanted to know what you thought.
I think it's even worse. Gender incongruence in the ICD-11 is worse, if you can believe that. It's worse than gender dysphoria in the DSM. But partly, they did an ingenious thing where that's the power of transactivism, that they didn't want it to be in the mental health section, the mental health chapter, so they pressured the World Health Organization to create a whole new chapter on, I don't know, sexual health disorders or something, and then they plunked it in there. And they went through all different versions of that. I read a funny one where they were pressuring the World Health Organization to define it in a sort of like a physical health issue, like that, you know, the men with a penis, that was something for urology and endocrine systems and stuff. And it was really, they'll do anything to divert attention away from what it really is. And it really is a psychiatric disorder, probably not very easy to live with. And there are people who need help. But gender incongruence is basically, there aren't any real diagnostic criteria. It's if you say that your body, your mind is incongruent with your body, then you should have access to body modification on demand as a human right. That's what's going on there. So it's much worse.
Hi, would you like to introduce yourself?
Hi, my name is Christian. I came from Germany. Thank you for all of this and for this room. How many parents are in this room? Thank you for being here. I mean, my mother can't be here because she doesn't speak English that well. She's from Mauritius. And for her, of course, it's an issue that I look the way I do. Technically, I'm pleasing to the eye, but yeah, right? But I've been given all the names, like drag queen, transgender. I mean, I've been in psychiatry since I'm 17 or 16 because this came out very early. I have not taken any hormones. I have not done any modifications to my body. But society, thank you, yeah. But society makes it so hard for people like me because we exist and we always need another label. And it starts at the bathroom because I'm not welcome in the men's room, I'm not welcome in the ladies' room. So I go to the disabled bathroom without disability because I don't feel that I'm mentally ill. I have not taken any medication, and I don't think it's necessary. They diagnosed me also ADHD, they diagnosed me with depression, then they said, no, it's not depression. How can you be with a heterosexual man? So sometimes I don't understand myself, sometimes I don't understand the whole thing, but that's all I wanted to say.
Would you please introduce yourself?
I'm Stephen Levine. I don't mean this to be a diagnosis. I don't mean this to be a diagnosis. But instead of the word trans child, which I don't like to use at all, I like to say currently trans-identified person. And I emphasize the word currently because now we have data that people desist in large numbers. And I think it's very important for parents to understand and mental health professionals to understand that when it comes to diagnosis, scientifically, there is inter-rater reliability, meaning that two people separately can make the same diagnosis at a high percentage of times. but there is no predictive validity, meaning that the diagnosis today does not imply the diagnosis will be present 5 years from today or tomorrow. So whether it's politically acceptable or not, I think about this as a currently trans-identified person.
Oh, so Dr. Levine is one of my favorite voices in this whole issue, and it's really, I'm honored to be speaking at an event where he is in the audience. We would all do very well to listen to everything that man has to say. I think I'm going to... I'm going to wrap it up now, so thank you all and enjoy the conference.